that they may have ingested something that they shouldn't, what should they do?
Give us a call at the Oklahoma Poison Center.
Lori, about how many calls do you all get here?
Well, I think a lot of people are surprised to find out that we get over 150 calls a lot of days, but around 150 per day. And for children less than 6 years of age, last year we got over 18,000 calls. And another thing that a lot of people are surprised to find out is that the way the Poison Center works to help you, one, that we're here for you, but I think people are surprised that over 75% of our calls we keep at home. It's our goal to help you out, and we're conservative in that, so we're not going to keep you at home if it's a risk for the child. But most of the time we can handle a call at home properly by the people letting us know what they got into, how much, when it happened. We can tell you what to do, what to watch for, and keep kids at home. And that's how we save you money, that's how we save the state money, because it's also been found in surveys that in areas that wouldn't have a poison center, about 75% of people are going to get help, usually in an emergency room, which makes sense because if you think about it, if you're sitting there and you're scared to death that your kid, people will think that their kid is going to die, and they're going to be all right, but they're scared, so they're going to get help from the emergency room. So it's good that poison centers are here to keep them at home and help them.
Well, that's a valuable service in itself. Who answers the phone here?
Well, everybody that works here at our center is a pharmacist, or we have one lady that's in school, in nursing school. But poison centers are staffed by nurses, pharmacists, or doctors in Oklahoma. And that's a national thing. Sometimes they have people that'll be with a certified specialist, but I think that it's kind of misunderstood that sometimes people think it's just volunteers, but we all have a medical background.
Well, I see a lot of materials here, so evidently you guys do more than just answer the telephone. So what are some of these things?
Yeah, that's one of my favorite parts about my job is that I go out and I talk to kids and adults about poison prevention. These are a few things that we have available. This is a brochure or some lesson plans that are for pre-K through 3rd grade and are available by just calling the Poison Center. We also have a home checklist, which is good for anybody because I mentioned that you need to keep kids away from the poisons, and this will help you do that. It goes through each room and kind of helps you poison-proof it real quickly. And then we also have brochures, First Aid for Poisoning. We have one on plants, and then one called Perilous Partners, which is about snakes and spiders and chiggers and ticks, which are all poisons and can, cause problems or lead to diseases. So these are really helpful for a lot of people, and you can get those by calling the Poison Center. And then we take out with us a board, and this kind of goes through the different ways that people are exposed to poisons. The most common ways are on the skin, which would include a spider bite or a snake bite, people swallowing a poison. Then they also can sometimes get it in their eyes, and by breathing something in or inhaling it. All of these things are some general first aid, which is mentioned in the First Aid for Poisoning on how to handle those exposures. The pictures on this board are some common things that people can be exposed to as well.
Lori, I see a lot of household products over here, and a lot of them look alike.
Yeah, these are our lookalikes, a few of them at least. It's easy to see for adults especially that this is something that looks alike. They'll clean their kitchen sink with Comet, and then they'll have some pizza or some spaghetti, and they'll sprinkle it with this. Luckily, they usually don't get sick, it just tastes real bad. But there's some other lookalikes here, and it's easy to see how kids could mistake Gatorade for Mr. Clean, and as well as a real common one that the mistake is bleach for water. So that just shows how easily things can happen, especially with kids who can't read and who don't know.
Well, I see something else here that I've had in my cabinets before, and that's the syrup of Ipecac.
This should be in everyone's household, and it's recommended to actually have one bottle for every child under the age of 5, because if you use this, sometimes you'll need to use it on a couple of kids because you don't know who got what. But what it does is it causes people to throw up. But what I like to tell people about this and make sure they understand is don't automatically give this. If somebody gets into something, you always need to call us before giving this, or call the doctor, because there are times you don't want to give it, such as if you swallow something that burns like bleach, it'll burn coming up, or for oily substances, they have a tendency to slip to the lungs, and it's called aspiration, but you increase that by making them throw up. And if it's in their stomach, they're going to be okay. So that's another instance where you don't want to give it. But like I said, just always call us before giving it, but make sure you have some.
Okay. What type of information are callers expected to give when they call you?
Well, when they call, we'll ask them for the child's age, the child's weight, what they got into, how much they got into, when it happened. We'll also ask for the person's name who's calling and their telephone number. It's not because we're being nosy, but like I said earlier, we want to make sure they're okay. We usually ask them to call us back, but if they happen to forget, which can happen easily in a daycare because you're just so busy, then we'll give them a call and make sure everything's all right. And I always tell people that if we do go to the emergency room, take the substance with you as well as the child. We've had cases where people show up at the emergency room and they're so scared that they even forget to bring their kids. So the substance and the kid when you go to the hospital.
Lori, this has been fascinating and very helpful. Every call you guys get, you're potentially saving someone's life.
That's right. That's why we remind everybody, please give us a call no matter what you think a kid has gotten into, even if you don't know for sure. And we also want to remind everybody that it is required that you have the Oklahoma Poison Center sticker posted in the child care centers and home. And the last reminder is keep everything up and out of reach.
Thank you.
Thanks.
Shelley, there's one last area we do need to cover in discussing choking and the young children.
That's right. You know, David, it's ironic that even things that children are meant to consume can be dangerous. Every year in this country, we have about 75 people die from choking on food. And round foods and those that are pliable and can conform to the airway are probably the most dangerous. Let's look at some potentially hazardous foods. Hot dogs, round hard candies, popcorn, grapes, nuts, and watermelon seeds are some of the leading culprits in choking-related incidences. If you're going to serve hot dogs and grapes to young children, what you need to make sure you do is cut them lengthwise and then cut them in smaller pieces. You know, David, safeguarding your environment means a change in your perspective. It means that you need to start looking at things from an infant or toddler's point of view. But you also need to remember that there's nothing more important than your constant, undivided attention. And if you prepare your environment before the kids arrive, then you don't have to worry about it and you can spend your time having fun.
Shelley, thanks so much for visiting with us about this topic today. We really appreciate it.
Our next expert is Diane Rudebach, an assistant professor at the University of Central Oklahoma. Diane is going to address health-related issues, including the importance of immunization. All of the topics Diane will discuss are found in your requirement book.
Diane, tell us a little bit about your current position at UCO and your background with health inspection.
All right. I am an assistant professor at the University of Central Oklahoma in Edmond, and I coordinate the community health program there. And what that entails is I teach quite a few classes on the control and prevention of disease and focus on prevention and health. And we are in the Department of Kinesiology and Health Studies.
What is kinesiology?
Kinesiology is actually the movement of the body, or studying movement of the body. And so we are in the PE department, and we have the health-related sections of the PE department.
Great. Why don't you walk us through a few of the things we need to know about running a healthy family child care home?
Sure. I, for quite a few years, inspected child care facilities at the City County Health Department, and through that had experience working with providers and child care professionals on what to look for. And one of the things I need to remind people to do is to really refer to the requirements, because the requirements are very clear, and it's very helpful when you refer to the requirements. But the family child care home is a little bit different than a child care center in that the people obviously live in the home, and the home becomes their business. And it's really important because families are in their homes, but then yet it's a professional environment as well. Right. And germs stay in those homes. And so what we want to have really is that balance of health. And if you think of it really in maybe 3 circles, the child is a circle, and the adults as another circle, and the environment as a circle, where those 3 circles come together. That's the important thing to focus on when we think about health, because the child comes in every day from their own home environment into the home, and then of course the adults or the providers come in from either